So as someone in the healthcare industry, you said it did change your relationship with your profession. Uh, will you think this report is going to wake people up, or do you think it's going to draw headlines for a week or two and then sort of fade into the background?
Well, my hope truly is that it will draw headlines and then it will cause people to start changing their ways. I mean, I think there are small pockets all over of people trying to make important changes. I mean, up here in Oregon, we have a
Absolutely.
Oregon Patient Safety Commission that is looking at early intervention and discussions between clinicians and patients after issues. But it's going to take a lot. I mean, a lot of people, and I can't believe that we can ask physicians to own this all. I mean, because there's so much on a physician's plate, they can't have one more thing on their plate. So we have to put a structure around, so it's infrastructure around, so it supports them in this measure.
Okay, so you're talking about hospital administrators, you're talking about what, patient satisfaction or patient experience officers, that sort of thing? Or is it more than that?
I think it's more than that, because I think there has to be an investigative branch. I came to medicine late in life. I started medical school at 37, and before that, I was an environmental health and safety engineer. And so if we had an accident or a near miss, we'd spend hours figuring out why. But this doesn't appear to be happening with regards to patient deaths. And so if we're not spending the effort and the time to understand what the past is, we're more likely to repeat it in the future. Yeah. And so I don't know why that's a disconnect in medicine, but it appears to be one, and a large one from my vantage point.
Oh yeah. Well, there's a lack of accountability. There's so many moving parts. A lot of physicians on hospital staffs are independent. Of course, small practices are independent. Even large medical groups can be fairly independent. Data doesn't flow from one place to another. Nobody really knows where the buck stops.
You're right. They don't. And, I think, at least in Anna's care, no one wanted to harm her. So your case is a slightly different one, I think, than Anna's. But they had missed, in medicine, one of the things you do is if someone has symptoms, you figure out, well, why might they have that symptom? And maybe it's due to overwork, or they were just tunnel focused on the neurologic symptoms.
Yep.
But chest pain's a big symptom,
Yeah, I would think so. Yeah.
Yeah. And she was a 59-year-old woman. So, it's not like she was 22 in chest pain. That would be a slightly different story. But a 59-year-old woman with chest pain, you at least got to consider cardiac.
Sure.
Yeah.
Sure. Well, yeah, you have people who are not cardiologists. They, like you said, they're tunnel focused on their specialty or the diseases that they know best.
Yes, absolutely. Yeah.
So what would you like to tell the public, having not seen this report yet, just knowing that it's coming out in a few days?
Well, I really think we need to ask our hospital administrators to put more money towards and a commitment towards improving patient safety, including helping their providers, become more engaged. I think we need to ask physicians, and even our own physician, to listen to complaints and consider that a gift. I mean, because if you learn of a complaint, then maybe you can change your behavior in the future. And then I think with patients themselves, we need to ask them, if a symptom doesn't go away, they need to be asking why and pushing hard to say, that doesn't make sense to me. So I think all different groups have roles in here, and I think we can't hand over our healthcare to our physician. We have to be that active player in our healthcare too.